Greetings all, I'm Cole Beeler, part of the medical response team for Indiana University. Our group of doctors is responsible for providing expert guidance for the shifting tides of the COVID-19 pandemic. Our chief philosophy is that all decisions related to how education is delivered should be guided by sound data that highlights the stressors that the virus can put on our community. Instead of using one metric as an on-off switch for guiding decisions about transitions to and from completely virtual education, all decisions will be viewed through a lens of a composite of metrics that attempt to understand the internal burden of disease, the external burden in the surrounding communities, our efficacy of local control, and the availability of resources to keep our constituents safe. Our list of metrics to inform us about the state of health at each of our campuses is reviewed regularly to assure we implement solutions as fast as possible to help limit the spread. In this dashboard, you'll find results from our mitigation testing of asymptomatic patients that we use to understand silent spread of the virus in our populations. Early identification leads to early isolation and protection of healthy individuals. You'll find how much we are testing, as well as our weekly positivity rates throughout the year. You'll find the same information for sick people pursuing care with our medical professionals at IU Health, but since they're sick, you're going to see a bit of a higher rate here. On review of the data, keep in mind that there are multiple factors that contribute to a successful semester. Each metric that we are following gives us a different view of the bigger picture, namely the overall safety of IU from widespread, unmitigated disease and morbidity. As trends develop, interventions are made in real time by our outbreak mitigation team to counter shifts in viral epidemiology. This check and balance system aims to keep us afloat as other areas are drowning. But we need your help. The data is just a marker of the decisions we make together. Being mindful of the data when making decisions about how much you interact with others and what type of activities you choose to partake in will help us course correct at early signs of spread. We vastly appreciate your partnership as we navigate this semester together. Even though there will be infections, the entirety of the school's infrastructure is committed to making evidence-based decisions on how to stomp out the virus before it becomes widespread. Thanks for your time and partnership.